Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a Chief Medical Officer in the United States, also an Associate Professor of Medicine. Let's look at a research study and do a critique. This article was actually published in New England Journal of Medicine. We're going to review this article and just go over the article. That's the whole purpose again. I know most of the clinicians and most of the patients don't have the time to go through a study. So we want to give in a nutshell what is the clinical finding, what are the strengths, what are the weaknesses, and all of that, okay? So this, before we say that, the liver cirrhosis is one of the deadliest diseases. Okay, the only reason, the only way these people can survive is undergoing a liver transplant because most of this damage are irreversible. So liver cirrhosis people go through a condition called hepatorenal syndrome. So what usually happens are kidneys started failing because of all the liver issues, and we call this syndrome hepatorenal syndrome. Once this hepatorenal syndrome diagnosed, the mortality rate is extremely high, 95%. Okay, so only in those patients there was an only option was like albumin. So now, in this study, they come with a new drug called Terlipressin plus albumin, and then find out is there an outcome? Okay, again, it was published in New England Journal of Medicine. Terlipressin plus albumin for the treatment of type 1 hepatorenal syndrome. The authors, let's recognize the authors for the hard work. Dr. Wong is the primary author. And then senior author on this study is Dr. Gonzalez. Okay. Now every study have a clinical question. When we talk about, let's talk about terlipressin. This is a synthetic vasoconstrictor analog with vasoconstrictor activity in splanchnic and systemic circulation. Okay. So that is the drug they use. Can terlipressin combined with albumin improve the renal and overall outcome in patients with a type 1 hepatorenal syndrome? That's a clinical question. So the population is, they took people greater than 18 years old with a diagnosed hepatorenal syndrome and cirrhosis, and the exclusion criteria: any active infection, recent liver transplant, conditions contraindicating terlipressin. Now, intervention, again, we got terlipressin infusion, albumin, they were both given, and the control group just give placebo and albumin, okay? Outcome measures, they look at the primary outcome measure, they verified the reversal of hepatorenal syndrome. What do you mean by reversal? They looked at the creatinine. If the creatinine has decreased greater than 1.5 decrease, that is considered a success. Okay. Secondary outcome, they looked at kidney function improvement, survival at 90 days, need for dialysis, and even death. They looked at it. Now the study design: prospective, randomized, double-blind, placebo-controlled study. Sample size, we got around 300 patients. They did calculate, they did do the intention to treat analysis, and they also used another method called the Hodgberg method, which because there's 4 secondary endpoint, they compared it to decrease the false discovery rate, okay? And the outcome, let's see what is the main outcome in this patient. When they used terlipressin in albumin, it did reverse hepatorenal syndrome in 29%, but the placebo, which got only with albumin only 16%, and the p-value was very, very significant. I think it's 0.006, which is less than 0.05, okay? So again, terlipressin and albumin reversed in the hepatorenal syndrome. And then the secondary outcome, mortality, did not change the mortality. Again, the bottom line, the mortality did not change. Again, that's the secondary outcome. Low rate of dialysis in the treatment group. Safety, there were increased adverse event in the terlipressin. There was abdominal pain, respiratory failure, and ischemia. Okay. Now, if you look at the strength, let's look at the strength and the weakness of the study. When you look at the strength, it's a robust design. That means a double-blind, placebo-controlled, and randomized. That's the key in here. When you have double-blind, placebo-controlled, randomized, then you can't ask further questions. That's like the gold standard, right? And the critically a clinical question like I haven't seen, like, people are dying out there. Focus on that. People, 95% of the people with hepatorenal syndrome died, but thankfully there are researchers or drug developers looked at this cause and see what we can do. They use the intention to treat analysis. That means they use a lot of people and even if they die, they used in the analysis. Good statistical method. In the one thing you always wanted to look at the statistic, they use this Hochberg procedure to adjust for multiple testing of the 4 secondary endpoint. Again, that's amazing. They did that. That can decrease the error in false discovery rate. I have not seen anyone using that frequently in some of the major articles. Okay. And now again, let's critique what are the weaknesses. No long-term follow-up. This is kind of like, we got 10 days, 20 days, 30 days, and they looked at 90 days. By the time 90 days, a lot of people died. Okay. Now, what is could be the significant? Maybe the MEL score on these people at the baseline were 32. When you have a MEL score of 32, most of those people is going to die. Why take those people with a high MEL score? Maybe a little bit less. Maybe we can find out. I mean, these people were like too sick to live. Most of them, I think a lot of people end up getting liver transplants. So don't take the people with so sick. So we need to know the drug is going to work in maybe the MEL score, maybe like 25, 26, that range, or less than around 20 to 25 I would have taken and see what happens. Okay, majority of male alcohol, and then use the alcoholic cirrhosis. Maybe I would have thought they should have used, the cirrhosis with the hepatitis. That's also another big contributor. Fatty liver, maybe. I mean, it's majority of this patient alcoholic cirrhosis. That's the question. They did not adjust for this nephrotoxic drug. It's kind of hard, right? Every drug, when you get sick, when they use in the hospital, and all of that have like a lot of nephrotoxic drugs are very hard to adjust, but could have an impact. And by the 90 days, the follow-up is less. Means a lot of people died or left, I don't know, but 50% of the people were not there at the end. I think a lot of people died. It could be the reason. Could, instead of using the creatinine, could they have used the GFR is also another question. Okay, take-home message again. Terlipressin is a new drug. Combined with albumin, it does have short-term benefits, but people will end up dying anyway. Mortality rate has not significant changes, anything. More people did die, even though it's not statistically significant in the Terlipressin group, but not statistically significant. But if you look at the numbers, more people died in the Terlipressin group. Okay, again, a new drug, Terlipressin, albumin for hepatorenal syndrome, give us a lot of hope. Okay, more studies can be done on the people who are not that sick and all that. So thank you so much for watching our presentation. Please continue to help us so we can provide a concise summary of the research article, and we understand how busy clinicians and see what are the strengths and the weakness and all of those kind of thing, and try to put some comments about the article in the comment section. That also give us feedback so people can have a discussion kind of going on. God bless, and please subscribe to our channel.